the national program for NCDs. We are here with the another webinar as a part of the national webinar series from our national training division. We have, I think, 13 webinars we have already completed, and now today we have the 14th one on health promotion. And every month, two webinars we are organizing, and we try to align them with some national or international days related to some NCD theme. And this particular webinar, we had this National Youth Day on 12th January. As a part of um, the youth awareness, uh, engagement with the youth, we have taken the topic of health promotion. And if we see the four major risk factors for NCDs, that is tobacco consumption, alcohol abuse, and uh, lack of physical activity or inadequate physical activity, and of course, as a part of increasing the engagement with the youth awareness, targeting them for health promotion activities, this will go a long way in making making health health initiative
Sorry for the interruption. So I think Dr. Vinas sir joined again. Yes, sir. Over to you.
Yes, yes, I've joined. I've joined. I was audible that time. Avdesh, I was audible.
No, sir, you were not audible actually
Acha.
clearly. Requesting you to
Okay,
please
okay,
repeat.
okay. So shall I start all over again?
Not only 2 3 minutes once.
Okay. So today we are joined in by our expert, Dr. Komal Shah. She is associate professor at the Indian Institute of Public Health, Gandhinagar, and is an eminent public health expert, particularly in non-communicable diseases and health promotion strategies. And as a part of our health promotion strategies under NPNCD, wherein we focus on the community engagement to have awareness campaigns, Fit India, Eat Right campaign. We already have had webinars on them. We had experts who are looking after Fit India and the Eat Right campaign in the country, and then targeted intervention. So we seek to learn a lot many new things, and the audience, the state nodal officers, the district nodal officers for NCDs, medical officers at the PHC, CHC, and of course the CHOs who have joined us with us. So it will be a very enlightening session for us. With these remarks, I would request Dr. Komal Shah to please take over, because I think Dr. Swasti Charan sir is already in a meeting, so maybe sir will join later on. Over to you, madam.
Sir,
Avinash,
actually, yeah,
I
sir
have
is
joined.
here.
Hmm. I have joined. So can you hear me, Avinash?
Oh, sir has joined. Okay. Sir, you are audible, sir.
Okay. Thank you. So good afternoon and welcome to all our participants again for this fortnightly webinar from the NCD division of the DGHS in the Ministry of Health in New Delhi. So it is a very cold morning here, foggy morning here, but we will try to warm up ourselves with a very exciting session from Dr. Komal Shah. National Youth Day, we all know, is celebrated on January 12, and we are trying to sync ourselves with this event commemorating the birth anniversary of Swami Vivekananda, a key figure in Indian history who introduced Indian philosophies of Vedanta and yoga to the Western world. So that's why we had taken up this topic in today's webinar. The day is remembered for emphasizing the importance of youth in the nation building and promoting their role and social and economic development of this country. And that social and economic development will only happen when you have health with us. So the theme for 2025 is Youth for a Sustainable Future, shaping the nation with resilience and responsibility. This, according to the health ministry, all of us sitting here, will only happen when you have a healthy life. So promoting health promotion in various ways that we can think of for prevention of particularly the non-communicable diseases, starts young in life. Although we have our screening programs starting from 30 years, all I say is that all those activities which will lead to many of these diseases which will start manifesting when you are 30 years happen much more before that. In India, as young as 7 years, children, 7-year-old children, they start initiating tobacco use. That's a very alarming figure we see in some of the states. And we all know that around 19, 18, 19, or when you are just entering the colleges, many of the risk factors like tobacco, alcohol starts. Nobody starts, very few people starts tobacco use after the age of 25 or 26, by which time you have already determine what you need to do in your life, and then you don't indulge in many of these activities. So this is very important that we promote healthy living when we are young. That's why the ministry has got various programs, particularly the national program for NCDs, who emphasizes on community engagement, empowering the community to take care of their own health. Although there may be many good schemes of the government to take care of you, but unless we take care of our health in our own hands, the government will always be inadequate. That is the first message I wanted to convey to each one of us. We need to also do together a lot of awareness campaigns in such a way that it becomes a culture. The healthy living becomes a culture, not a compulsion. And also, we are doing a lot of targeted interventions in many states like Tamil Nadu and Kerala, etc. And in conclusion, I would like to emphasize and reinforce the importance of youth participation in health promotion efforts to combat the NCDs, and also encourage the attendees who are here to take proactive steps in their communities or in the health facilities where they are posted to promote healthier lifestyles and prevent NCDs for the community as well, and also for themselves. They should also be the role model for the community in which they are serving. With this message, I would like to welcome once again Dr. Komal Shah, who is a prominent figure from the Indian Institute of Public Health, Gandhinagar. Madam is an expert in public health, particularly in non-communicable diseases and health promotion strategies. So I hope all of us will have a very exciting webinar with Dr. Komal Shah. Thank you very much, Madam, for joining, and the stage is yours now.
Thank you very much, sir, for briefing us and actually motivating all of us, emphasizing a lot of importance of health promotional activity. I completely agree, and I would be actually adding a bit more to what is already known to us, and starting with the definition of youth. So now there is no more what we call above the age of 30 or 40 as what you call aging population. Now aging starts very, very early, as you have mentioned, in the school-going kids or somebody who is into adolescent and all those age group, which was prior considered as something really protected age group. So definitely, it is indeed my pleasure to have this webinar and share some of my thoughts with you. And I look forward to have a very engaging and an interactive sessions. So if everybody is there, may I start with the presentation?
Yes, ma'am, you have the access.
We may start, ma'am. Yes.
Thank you very much. Hope my slides are visible.
Yes, ma'am.
So I've been given an opportunity to talk a bit about health promotion and why this is very much important in the area of non-communicable diseases. I'll be paying a little bit more attention to what our already ongoing programs are and how they have got a very important and integrated components of health promotion, not only related to screening, primary and secondary care, but also in overall delaying the events in adultery, and now we are looking forward to have these programs for our kids and the children's. So just to give you a brief idea, brushing up all our already known knowledge, what do we mean by non-communicable disease? So by definition, something which is individual specific, it is not transferred from one person to another. It is lifestyle based diseases, especially associated with lot of urbanizations. It is chronic in nature, so majority of the time when you have these diseases, they stay with you for reasonably long amount of time. Common NCD, though I have mentioned a couple of them, but the radar is now expanding like anything. So we have been like topping the list, global list in terms of cardiovascular diseases, diabetic, and the hypertension burden. So India is a major contributor, global contributor to this disease-associated morbidity, mortality, and to a great extent, cost that is incurred to health system and the populations. So some of the other diseases, cancer, chronic respiratory diseases, asthma, you can see this disease burden, how many people are being affected by these particular diseases in India. And the statistics says it's all, why these diseases needs to be paid attention. Now, there is only one a brighter side to this entire situation scenario, and which is these diseases, if identified early or if you indulge into very good health promotional activity, can be delayed, can be prevented, and we can save lot many productive years of our population, which might be wasted if we are not addressing this situation or these issues right at a early and appropriate time. So there are various levels at which these preventive strategies can be implemented. This could be at a primary, secondary, tertiary care level. So primary, where the risk factors, primordial, where the risk factors needs to be prevented right from the precipitation. So as I was mentioning, tobacco, alcohol, the best way to avoid risk associated with those factors is to not get indulge into them at all. So once you have developed that habit, it is very, very difficult to get rid of those habits. So the health promotion should essentially focus around the risk factors, which are the major contributor of these NCD. And in that, the tobacco, alcohol, hypertension, some of them, they have attributed the maximum amount of mortality and morbidity. So these are the area where we can prioritize our strategy. So primary prevention, where we are actually taking care of the risk factors. Secondary prevention, where we are actually trying to see the early progression of the diseases. So screening, early detection, and the treatment. Tertiary prevention. So whenever the disease has happened, how do we best manage it? So in that pyramid, the largest and the base pyramid is the health promotion. So if we pay reasonably good amount of attention to health promotion, I think the risk factors, its prevention, and the disease onset can be very well taken care of. Now, coming to our programs, which actually essentially addresses all these elements, and the objectives are quite widely placed to essentially provide a comprehensive care and a comprehensive screening programs for these diseases. So it has the first objectives as health promotion. So how do we promote healthy behavior? And if we are indulged into some unhealthy behavior, how we can introduce a behavior change with involvement of community, civil society, community-based organizations, media, and development partner. It's the fundamental objective of this program. The second one, screening, early diagnosis, management, referral, and follow. So this is also some of the health promotional activity where you promote this dissemination of the information and encourage people to come up with screening programs and early diagnosis, building a capacity of healthcare providers as well as the community members, strengthen up the supply chain management, monitoring, supervision, and coordinate between the program as well as other program people, because this is not this disease cannot be addressed in silos. We need to work together with multiple program partners and with multiple ongoing schemes in order to address that. Also, primary, secondary, and tertiary care level needs to come forward and have a very good dialogue with each other to strengthen the referral systems. So this is something a very wonderfully placed diagram that I figured that I collected from the program's operational guideline, which essentially provide the gist of entire health promotional aspect of this particular program. So you need to take care of the habits and the risk factors. So for that, we need to generate a lot of awareness. We need to make community aware about that, yes, tobacco is a risk factor, alcohol consumption is a risk factor, salty food is a risk factor, lot of screen time, not having your physically active lifestyle, obesity, not getting yourself checked properly, all of these are risk factors. So when you place our activity around emphasizing the role of community in understanding this risk factor, the health promotional activity can get a very good boost. So majority of the time we don't we don't have a community awareness component in the program, and then the entire system might not be able to work properly. So these risk factors generally leads to a condition what we name as NCD. So overweight, obesity, hypertension, diabetes, dyslipidemias, metabolic syndromes, cardiovascular diseases, stroke, all that. Now, I have been given this, opportunity to talk about health promotional strategy. So I've tried to segregate it into some actionable points where our system is already paying attention to. And this can be utilized as a prioritization strategy also. So we have already identified that the major contributor of NCDs as a risk factor is tobacco. So tobacco and other addiction management is very, very much needed, and our health promotion strategy aligned with these risk factors management or this risk factors, prevention in the community would yield definitely very good results, not only in prevention of NCDs, but also saving our youths from saving all those productive years. So tobacco and the and other addiction management generally that revolves around what we call as primary or primordial prevention. So people should not get indulged into all this kind of activities. So it should start from school level itself. So a lot of our program, they IC material, BCC material, they talk about ill effects of this tobacco, alcohol, ill healthy other habits. And that's essentially the area where we need to pay attention. And the same thing applies with a lot of other risk factors, like if we are indulged into what we call as dietary practices, which are not very good for our heart or lungs or our overall metabolic activities. So we need to pay attention to salt restriction. We need to make our community aware that these are the set limit of salt consumption, 5 grams per day. We need to avoid certain food. We need to lower fat intake, consume a diet, which is something what we call as good diet versus not so good diet. What should be frequency of fruits, vegetable, why there's a need to have a colorful plate, what proportion amount should be considered in terms of carbohydrate, proteins, and fat, which are the good fat, which are the bad fat, in the vernacular language, in something which community can relate to. With this millets program, we also need to pay attention to vitamins, fibers, macro and micronutrients, both the contents. So essentially, nutritional and the dietary changes. First, it should be aligned with the community's understanding and where community feels that this is relatable. So something which we actually picks up from the global sources might not have a contextual appeal. So that's where something which is universally true, like salt consumption, and there are certain interventions which had to have contextual basis, like millets and the fruits which are locally available, seasonally available. We should promote those kind of activity, which will have a huge impact on overall anxiety management. Certain diets which will have saturated, unsaturated fats. So we should be avoiding saturated fats. We should have understanding of MUFA, PUFA, what is good for us, what is not good for us. Where do we have our local oils and which oils are good? How do you cook them? All those understanding should reach to a community level. And that is where the essential role of ICBCC material is there. We need to also promote the whole grain, something which is not refined, not very much processed. What is the proportion of protein, moderate? What could be the vegetable-based proteins? What could be the non-vegetarian meat-based protein? In that also, what is good, what is not good. So this is one other element of health promotional strategy. The first could be essentially tobacco and other addictions. Second could be dietary changes and the nutritional understanding in the community itself, and where we can promote that these are good food, these are not so good food. You can indulge daily into these food and you can have occasional access to these kind of foods. Behavioral changes. When we actually state that this is good, this is not good, we also need to empower community where they can actually do these changes by themselves in their own lifestyle. They can integrate these changes. So that's where we need to have change makers playing a role. We need to have a strong bond with the community where we can show them that this is how this can be done. Lifestyle modification is not a taboo. You can manage it by yourself. You have your own champions around yourselves and you learn from them, diabetic champions, and there are self-help groups which can help them out, which can have a very periodic contact with these kind of patients, and that's where we actually laid a very solid foundation of the health promotion. We also need to educate the community about some of the known and a very high prevalent NCDs like hypertension and diabetes. What are its consequences? How you can delay those onset if you already have it? How you should be monitoring that thing. We can also go back to our very ancient practices of yoga and meditation, which has got a very good contextual appeal. So rather than promoting something which is again westernized or something which is adapted from other part of the world, we can promote something where our community is quite familiar with. So yoga, meditations, and community-based some of the physical activities, some days celebrations, where they can link themselves, they can relate themselves to those kind of changes. This could be physical activities related changes. This could be mindfulness related changes, Ayush programs. This could be some of the dietary recommendations. So when we are planning to have some behavioral changes, the essential component is the context. How do you establish a context and how do you make them feel relatable to these changes? And that's where you get a very good sustainable development in this area. The next one is weight reduction and physical activity. There is a huge a population which is with urbanization and with the kind of transition that we are seeing as a community or as a nation, there is a lot of sedentary activities which are happening around our day, and that's where we need to pick up some time frame, some really good intervention strategy which can promote physical activity in a very contextual manner. Some small breaks, what stress and sedentary lifestyle is doing to human body. We need to make community understand this thing. What is an importance of regular physical activity? So we also need to emphasize that these are the area where very little amount of cost or almost no investment is needed. So this can be applicable to urban, rural, tribal, all the settings. And if you adapt this, these are some of the very known health promotional activities yielding excellent benefits. We also need to pay attention to high risk and a secondary prevention strategy. So where a community needs to be made sensitized that you have this risk factor, that's fine. These are manageable through these simple strategies. This risk factor, if are not managed in an appropriate way, these can lead to some of the what you say cost, which is very huge when you're comparing it with the what you say screening management or the prevention cost. So this is something we need to clearly convey as a lesson. And uh, early start is the key. So when we are tapping our very young population with all this intervention and with all this health promotional material, studies have shown that it yields fantastic results. Something which is delayed as a bad habit, which is delayed, people generally don't tend to go into those habits. As sir has given us an example of tobacco. This actually applies other risk factors also. Somebody who has been very much physically active, it is very difficult for that person to become physically inactive in later part of their life. So these promotional activity, this promotional strategy, if we start really early addressing our youth, this can yield very good less results in the portfolio of our NCD programs. We can also generate a lot of community awareness educations through having some fairs, workshop, local events with local partners and the community leaders, where this promotion activity prevention measures can be made available for our population. Mental health is also emerging as one of the what you say important risk factor if not addressed properly for all these NCDs. That's where our ancient practices like yoga, meditation, mindfulness, and community-based engagement, community leaders plays a very important role. We need to raise awareness about all these conditions and provide counseling services. Immunization programs for some of the cancer programs and cancer related morbidity mortality. Now we have a lot of vaccinations available and it has proven to protect us from all these cancers. So health promotional activity can also emphasize on these programs where with this immunization we can eliminate the risk of these diseases. School health programs, we can strengthen, we do have a strategy of strengthening our school health programs, which essentially tap our population quite early where they are very vulnerable, where they are vulnerable to all these risk factors. And if health promotion is introduced at this level, very early age level, I think it leaves a very important footprint in their mind. And that's where education can play a fantastic role in avoiding tobacco, alcohol, ditching the what you say, fast food practices, what is good, what is not so good, encourage participants to indulge into sports activity, outdoor activities, fruit breaks can be introduced, and importance of protein, balanced diets, importance of colorful plates can be introduced over here. And our school health programs are very well doing this. So health promotional activities can be focused around this area. Now, there's a lot of opportunity for us to work around this health promotional activities. So all of us are knowing about this CBAC forms where above the age of 30, all of them, they are supposed to be screened. And this gives us a scoring. So this CBAC form based data sets can be very well utilized not only for managing and referring the population, but also for what you say, using it as an health promotional platform. So somebody who is having a, say, for example, family history of a disease. So using this opportunity where we are filling the CBAC form, we can counsel them that this is how you have a family history of this diseases, and if you indulge into good dietary practice, if you stay away from all of these risk factors, you can delay the onset of NCDs, or you cannot have that NCDs. There are all the possibilities. So these are some of the very good platforms. Then we have this village health sanitation and nutrition committee days and all those platforms where there are organizations of the camp and the community interactions and the community level screening promotions are there, and where we can establish a very strong bond with the community. So we can utilize these opportunity to disseminate this knowledge in the vernacular language, in the contextual manner. And that's where the NCD onsets can be delayed and people can be made sensitized that we don't need to be fearful about these diseases. The good thing is that if you pay attention to through 2 3 factors, stay away from tobacco, get yourself moving, get your body moving, pay attention to good dietary practices, and you can delay this. So these are the fantastic opportunity where we can pay attention for having a very good health promotional activity. At a primary, secondary, and a tertiary, at all level, counseling can be really useful. There could be opportunity screening, there could be active, passive, both kind of a screening, and this is essential for two of our important NCDs, hypertension and diabetes, where lot of our community is not even aware about their blood sugar level. Say, for example, they are not aware about their blood pressure level. So all this opportunity can be utilized to make them, one, aware about the diseases, and then second, what you say, motivate them to come up for their screening, and if they come positive, adhering to the management protocol. So this is where health promotional strategies can provide us really good dividend. So with this, I'll take a pause, and I would urge to let us together collectively take action to prioritize and protect our health and our community's health to reduce the burden of one of the uh, biggest challenge of emerging India, which is NCD. And let's build a healthier future. So with this, I'll take a pause, and I'll be happy to interact further on this area. Thank you.
Thank you, ma'am. I think we will see if we have any question. Uh, Introduce the importance of one of the audience members have asked. Introduce the importance of physiotherapy in prevention of NCDs. Uh, I think that also is an area. Physiotherapy, it comes basically under elderly program. We already have physiotherapy services at the CHCs and at the district hospitals. So I think that physiotherapy component is being covered under that, I think. And I think, ma'am, you have comprehensively covered all the areas related to health promotion. And of course, your point that something taking up those health promotion activities, particularly which have some familiarity with the community, so that people can link and relate something which has been practiced in the community for over the years, and then we advocate to have something like yoga and meditation, and of course other local sport events, local sports which are the, we have a lot of every state has a sport of their own. So all of this, and that points especially that people who start activities early, it is very difficult for them to be inactive later on in their life. So of course, and how you have linked in that slide from CBAC to all the initiatives, opportunity for health promotion, how you have linked all the existing uh, initiatives of the government under the CPHC or under the NHM, which we are doing at the Health and Wellness Center or the Ayushman Arogya Mandir PHC and CSCs, those initiatives which we've already done. And so thank you for those, for highlighting all of them. And we have CHOs, many CHOs also have joined. So CHOs also have a role since they are directly in touch with the community. Because at 5,000 population we have HWC or sub center wherein the CHO is stationed. So they can play a very crucial critical role, of course, apart from health screening, taking innovative steps also, which is conducive for their locality regarding health promotion and health to mitigate NCD. So I think, and of course, we are thankful to the team from ECO. Avdesh Tripathi is always there with us for any kind of support from the back end as well, and all the background which goes into organizing this webinar. We have been able to successfully continuously do it, and from all over the country. So we are also supporting us with this. Avdeshi, I think Avdeshi.
Yes, sir.
So I think we are already 6 minutes above schedule, so we can wind up the webinar.
Yes, sir. Sure.
Okay, okay. Thank you, ma'am. Thank you, Eco. Thank you, Avdesh ji. Okay, thank you.
Thank you, sir.
Thank
Thank you,
you.
ma'am.
Thank you, everyone.
Thank you,
Thank you.
participants.